Okay, now we're going to move into anatomy and physiology. If you've not taken a AMP course or have had anatomy and physiology in high school, this, like medical terminology, is something that you just acquire over time. It's always a good idea that, just like with medical terminology, that we understand not only all the parts of the body, but to a simpler degree, how those parts all work together. So we're going to start right in with the musculoskeletal system as part of our anatomy, and the whole purpose of musculoskeletal, by virtue of the word, we're referring to the muscles and the bones. And the muscles and the bones have three main functions. They give your body shape, they protect your vital internal organs, and muscles provide movement of the body. The skeleton itself, you have just enough bones, I think 206, just enough bones to make a complete skeleton. It consists of the skull, the spine, the ribs, and the sternum, the shoulders, the upper extremities, the pelvis, and the lower extremities. Now, when we look at the skull is made up of four bones, four pair of bones. And at birth, those bones are not fused together. So there are what you're familiar with as soft spots in the skulls of babies. They're known as fontanelles. And as we grow, you can see those suture lines that are being referenced here. These suture lines is where these bones eventually do grow together. So when we look at the skull is made up of four pair of fused bones in the adult patient. You've got two frontal bones, a left and right frontal bone. You have two parietal bones. You have two temporal bones, and you have two occipital bones. And they form an inflexible box that does not give, and it has one natural hole in the base of the skull that we can't see in this diagram, known as the foramen magnum, which is Latin for big hole. And that's where the spinal cord comes up and becomes the brain stem. And then the face is attached to the skull as well. The face is made up of multiple bones to include the sphenoid bone, the nasal bone, the lacrimal bone, the orbit, where the eye sits, the maxilla, which is your upper jaw, and your mandible, which is your lower jaw, and then your zygomatic bones, which are your cheeks. And that makes up your face and skull. Now, the spinal column is 33 vertebrae. The spinal column is essential for movement. Out of each vertebrae comes two motor nerves and two sensory nerves, going to all parts of the body. So the sensory nerves will relay things like hot, cold, pressure, pain, pleasure, back to the brainstem, and then the motor nerves will elicit a motor response. The thorax, or the chest, contains the heart, the lungs, and the 8 great vessels. The ribs that make up the thorax, along with the spinal column, help protect the heart, the lungs, and the major blood vessels. So here is a diagram of the spinal column. Each one of those vertebrae stack one on top of each other. There is a disc in between each of those. You may hear of people who herniate a disc, and that's that little soft cartilage that acts as a cushion between the bones of the spinal column. You have 7 cervical vertebrae, you have 12 thoracic vertebrae that correspond to the 12 ribs. You have 5 lumbar vertebrae, and then you have the sacrum and the coccyx. The sacrum are vertebrae that are fused together, as well as the coccyx, or the tailbone, which is fused together as well. Now, the spinal cord does not run down all the way to the sacrum. It exits at the lumbar region into a big fan of nerves known as the caudal equina that services the pelvis and the lower extremities. The pelvis bones include the ilium, the ischium, the pubis, and the hip joint. And the hip joint is made up of the acetabulum and the ball at the proximal end of the femur. So when somebody breaks their hip or fractures their hip, they don't actually break their pelvis per se. They usually just snap that ball off the end of the femur. The lower extremities include the femur then, which is the largest bone in your body, the patella, which is your kneecap, and then the tibia and the fibula are the two bones of your lower leg, as well as your ankle. And then you have a lateral malleolus, which is the outside of your ankle, and the medial malleolus is the bump that you feel on the inside or the side of your big toe. Your foot is made up of your metatarsals, your heel, and your phalanges, which are your toe bones. Your upper extremities include your clavicles, your scapula or shoulder blades. Your acromion process is what makes up which is part of your shoulder. The acromion process, along with the clavicle and the scapula and the head of the humerus, makes up your shoulder joint. Your radius and ulna are the two bones of your lower arm. You have your wrist with multiple bones, and the long bones in your hand are your the wrist bones are your carpals. The long bones in your hand are called metacarpals, and then the bones of your fingers are called phalanges. And here is just a diagram identifying all those bones that we just spoke of. So it's important to learn what these bones are called, because if you're talking about a femur fracture, or somebody tells you they had a medial malleolus compound fracture, you'd know exactly what part of the body they were talking about and where it would be located. Now, joints are formed when bones connect to one another, and there are two types of joints, basically two types of joints, ball and socket, which is what we see in the shoulder, which is what we see in the hip, and then hinge joints is what we see in the fingers. Now, muscles, there are three types of muscles. There's skeletal muscle, there is cardiac muscle, and there is smooth muscle. Now, skeletal muscle is also known as striated muscle, just because of how it looks under a microscope. Skeletal muscle is under voluntary control. In other words, I can command skeletal muscle to move. If you move your arm, if you move your legs, any muscle that you command to move is skeletal muscle. Smooth muscle is what your arteries are made up of. And smooth muscles are under autonomic control. Think of it as automatic control. Smooth muscles are found in your stomach, they're found in your intestine, they're found in your arteries. We don't have to consciously think about constricting or dilating our blood vessels in order to maintain blood pressure. We don't have to constantly think about moving and propelling food from our mouth through our whole GI tract. It's just something that automatically occurs. Cardiac muscle is extremely unique muscle, and we'll talk more about that in the cardiac section of the program. Cardiac muscle refers specifically to a unique tissue found in the heart that has some very unique properties that we'll again talk about in that portion of the class. Now, the purpose of the respiratory system is to bring in oxygen when we inhale, but then also to get rid of carbon dioxide when we exhale. Now, air enters the body through the mouth and nose, where it is warmed and humidified and filtered, and it moves down into the back of the throat and then towards the lungs. It passes by the epiglottis, which is a little leaf-shaped muscle that closes over the glottic opening, which is the opening to your trachea. The epiglottis can become inflamed, as we'll learn. Epi means above. Glottis is that leaf-shaped muscle above the trachea that slams shut when you swallow so you don't get water down into your lungs or food down into your lungs. A little important feature that we need to know. The larynx is your voice box, and that's where your vocal cords are. They're in your larynx. In men, it's more predominantly seen because a male may have a very predominant Adam's apple, and that's where the larynx is. The cricoid cartilage forms the lower portion of the larynx, and that's important more as a ALS person because we can do a cricoid thoracotomy, needle cricothyrotomy, in somebody who has a complete airway obstruction. Now the trachea is your windpipe. It extends down from the glottic opening to an area known as the carina, and the trachea divides into a left and right main stem bronchi, and the bronchi divide into smaller bronchioles, and the bronchioles divide into terminal bronchioles that are surrounded by air sacs called alveoli. The diaphragm is a very important part of the respiratory system as well. The diaphragm contracts and flattens. The intercostal muscles contract. That makes your chest large, and much like a billows, as your chest becomes large, the pressure inside your chest becomes less than what's out in the room, and air rushes in to fill that space. So all those things we just talked about are displayed here in this particular diagram as well. You can see the trachea dividing into a left and right main stem. That's at the area of the carina. And you can see the terminal bronchioles, all those little hair-like, all those little air passages. And those are surrounded by lung tissue, which is alveoli. Now you have lobes of your lungs as well. You've got 3 lobes on the left, or excuse me, 3 lobes on the right and 2 lobes on the left. Functionally, the reason we only have 2 lobes on the left is that the heart primarily occupies a big space over there as well on the left. So there's no room for a 3rd lobe. Now, inhalation is an active process, and what we mean by an active process is that inhalation requires energy, and so we have to have energy to breathe. If we don't have energy, if we don't have the necessary sugar and oxygen and things to produce energy, if we don't have that energy, it's very difficult to breathe. And if we get into a situation where we're breathing really hard and really fast because we have a medical condition like asthma or pneumonia or something like that, we actually can burn up all our energy and quit breathing because we just have no more energy to inhale. Now during inhalation, this active process, the diaphragm and the intercostal muscles contract. The diaphragm goes down, the ribs pull the chest up and outward, and that negative pressure allows air to go into the lungs. Gas exchange takes place, and then on exhalation, the weight of the chest and the diaphragm returns to its normal position, and the weight of the chest forces the air out of the lungs. Now, ventilation is the term that we use to describe the movement of gases to and from the lungs, or to and from the air sacs. Now, you have 700 million alveoli, and they're not all full of air all the time. As we sit and we rest, alveoli collapse, and they stick together when they collapse. And the collapsing of alveoli from lack of air movement is known as atelectasis. Well, obviously, if alveoli are collapsed, they can't play in gas exchange. And if enough of the alveoli collapse, you get a large portion of the lung that isn't functional. And so what your body will do is you'll either yawn or you'll sigh. Now, a sigh is not unrelinquished love. It is your body telling you you need to take a deep breath and open up those alveoli that have collapsed. Now, respiration is the exchange of gases between the cells and the bloodstream. So respiration is out at the cellular end. Ventilation is just getting air in to your lungs so that gas exchange can take place. Now, oxygenated blood is carried from the lungs to the heart, and then it's pumped to the rest of the body. At the cellular level, oxygen is exchanged with cells for waste, cellular waste, and carbon dioxide. And then that deoxygenated blood returns in veins to the right side of the heart. The right side of the heart pumps that deoxygenated blood to the lungs. Gas exchange takes place in the lungs. And then that freshly oxygenated blood is pumped from the lungs to the left side of the heart, where the left side of the heart pumps that blood to all parts of the body so that it can get to the cells and the oxygen can come off and the carbon dioxide can be picked up. Now, something to keep in mind, we talked about the anatomy of the upper airway, the tongue and the jaw and the nasopharynx and the oral pharynx and the epiglottis, those sort of things. Children have slightly different anatomy that can lead to respiratory compromise that we should be aware of. One is that their tongue is much larger, their mouth is much smaller. As a result, their tongue is a more common form of airway obstruction when they're unconscious, lying flat on their back. The child's trachea is narrower and shorter, so it's more easily obstructed with fluid or a foreign body. The cartilage in their neck is, in their trachea, is less rigid and less developed, so it's softer. And when a child works really hard to breathe, they can actually collapse their trachea as they're inhaling very hard. It's the cartilage bands of the trachea that keep it open when we do breathe. Otherwise, the trachea would collapse without those cartilage bands. In any event, all those things, the larger tongue, the smaller mouth, the shorter trachea, the narrower trachea, make the child more prone to airway obstruction if they're unconscious lying flat on their back. The other thing to keep in mind is that their occiput, the back part of their head, can be very large, causing the child to tilt forward. So they can hyperflex when they lie flat, which also will cause an airway obstruction. The cardiovascular system is made up of the heart, the blood, and the blood vessels. The heart is a 4-chambered, electrically driven muscular pump. The 4 chambers of the heart include 2 atria, a left and right atria, and 2 ventricles, a left and right ventricles. So you have the right side of the heart and you have the left side of your heart. The right side of your heart pumps blood to the lungs for oxygenation, and the left side of your heart pumps freshly oxygenated blood to all parts of your body. So here is the anatomy of the heart with the direction and flow of blood being identified by the 1, 2, 3, 4, 5, 6. And it's important here that as an EMT, you understand how blood flows through the heart and what happens when that pump doesn't work right. So as an example, if I understand that all blood comes to the heart from the superior and the inferior vena cava, these 2 large veins dump the blood into the right atrium. Blood flows from the right atrium through the tricuspid valve into the right ventricle. When the right ventricle contracts, it pumps that unoxygenated blood through the pulmonary arteries. Now, this is the only part in your body where unoxygenated blood travels in an artery. Once the blood is oxygenated at the lungs, it comes back from the lungs through the pulmonary veins. In the pulmonary veins, this is the only vein in the body where freshly oxygenated blood is carried. The pulmonary vein dumps the blood into the left atrium, where it then goes through the mitral valve into the left ventricle, and then the left ventricle pumps it out the aorta to all parts of the body. So it's important, again, as an EMT, that you understand the flow of blood. If the right side of the heart fails, which it can from heart disease, heart attack, that sort of stuff, blood is going to back up through the superior inferior vena cava, causing jugular vein distension, swollen ankles, enlarged liver, those sort of things. If the left side of the heart fails, which it can from congestive failure or heart attack, blood's going to back up into the lungs, causing acute pulmonary edema or fluid bubbling inside the lungs, which is going to impede gas exchange. Now, the heart, as I had mentioned, is an electrically driven muscular pump. And the primary pacemaker in your heart is the sinoatrial node. It normally fires or discharges an electrical spark at a rate of 60 to 100. When it discharges, the electricity travels through the internodal pathways, causing both atrium to contract at the same time. The electricity ends up here at the atrioventricular node, which is the gatekeeper to the ventricles. It's going to hold that electricity for a split second, no more than 0.2 of 1 second, and then let that electricity go down the bundle of His, where it then goes down the right and left bundle branch through the Purkinje system, and as the electricity travels through the Purkinje system, both ventricles contract. So you have a spark, the electricity travels from cell to cell to cell, both atrium contract. They fill the ventricles full of blood when they contract. Then when the timing is right and the electricity flows through the ventricles, both ventricles contract, pumping blood to all parts of the body through the left ventricle, pumping blood to the lungs from the right ventricle. It's organized, it's coordinated, it moves blood from your 5th week of conception until you die. There are some arteries that you should know as well when it comes to circulating blood. Arteries carry freshly oxygenated blood, with the exception of the pulmonary artery. You have coronary arteries. Coronary arteries are arteries that are on the outside of the heart. The coronary arteries supply blood to the heart. The coronary arteries supply blood to the heart tissue, the heart muscle. That's where that muscle gets its energy and nutrients. The coronary arteries come right off the aorta. The aorta is the largest vessel in the body. It carries your freshly oxygenated blood and divides quite quickly into other major arteries, your carotid arteries in your neck, your femoral arteries in your legs. Typically, when we obtain pulses, we're finding an artery and palpating or pushing that artery against a bone so that we can feel the pulsing of the blood as the heart beats. So we'll look at obtaining pulses through the carotid artery, which you do in CPR, as well as a femoral artery in the leg, brachial artery in children, or infants, when you're trying to determine the need for CPR, and then the radial artery when checking pulses in patients as well. The posterior tibial artery is on the back side of the leg, and the dorsalis pedis artery is on the foot. Now, what is in blood that makes it so important? Well, the vast majority of blood is made up of plasma. Plasma is the transporting medium that carries these blood cells to all parts of your body. The cells in your blood include red blood cells. They're known as RBCs or erythrocytes. Cytes means cell, erythro means red. They're also called red corpuscles in older texts. We typically just refer to them as RBCs. Red blood cells carry oxygen. They have the hemoglobin molecule on the red cell that has an affinity to attract oxygen. So we need red cells to carry oxygen to all parts of our body. People who lack red cells are called anemic. White blood cells, or WBCs, are leukocytes. Again, cytes means cell, leuko means white. They're also called white corpuscles in older circles. What we typically refer to them as WBCs. Now, WBCs, there are 5 types of white blood cells, and they are available in your body to help fight infection. And depending upon which one of the 5 is most present, they can determine at what point of the infection you are. Early in the infection, certain white cells are more prevalent. Later in the infection, other white cells are more prevalent. So they'll do a white count. They'll look to see what your white count is and identify those cells and how many are present. Platelets are responsible to help you clot. If we look at red cells or white cells under a microscope, they're round. And as those cells get together, as they accumulate or aggregate together, they just roll off each other. With platelets, those cells have fingers. They're very irregularly shaped cells. And when they get together, they have a tendency to lock up and help form a clot. The pulse is a pressure wave of blood flowing down an artery when the left ventricle contracts, pumping blood to all parts of the body. And again, we can feel the pulse when we compress an artery over a bone. The most common pulses that we're going to check are actually the carotid in the neck or the radial in the wrist. The brachial is on the inside of the arm. Again, the posterior tibial is behind the leg, and the dorsalis pedis is on top of the foot. And the femoral artery is located in the groin. Now, pulses near the center of the body are called central pulses. They include the carotid and femoral pulses. Peripheral pulses are pulses that are out in the periphery, away from the central or core part of the body. The force of blood exerted against the wall of the vessel is known as the blood pressure, and we measure it in a top number and a bottom number. The top number is the systolic pressure, and that's the pressure in the arteries when that left ventricle contracts. The bottom number of your blood pressure is known as diastolic, and that's the pressure when the left ventricle refills. But more importantly, the diastolic number is the pressure in the arteries all the time. And the higher that diastolic is, the more pressure is exerted against the walls of your artery, and the harder your left ventricle has to work to pump blood to all parts of your body. So we're real concerned about that bottom number. Perfusion refers to adequate circulation of blood for the exchange of oxygen and waste products. So adequate perfusion means that freshly oxygenated blood flows to an organ, through an organ, and exits oxygen poor and full of waste. Hypoperfusion is the term that we give for shock. Hypo, not enough, perfusion, not enough blood flow to your tissues. So when blood flow becomes inadequate, it's known as hypoperfusion or shock. And there's a variety of different types of shock that we'll discuss later. Now, the cardiopulmonary system refers to the heart and the lungs. These two systems must work together in order for perfusion to occur. We have to be able to get oxygen into our bloodstream. We have to be able to pump or move that blood, that oxygenated blood, to all parts of our body. And then we have to be able to get that carbon dioxide back to the lungs where it can be expelled with exhalation. So anything that affects the function of the lungs, anything that affects the function of the heart, anything that affects the onloading of oxygen into the blood or the offloading of oxygen at the cells is going to lead to shock. The lymphatic system is a drain system that captures fluid. The lymphatic system helps us maintain our balance of fluid as well. The lymphatic system includes these lymphoid organs, your tonsils and adenoids. Many people don't have their tonsils and adenoids anymore. They were removed at an early age or removed as a result of chronic throat, strep throat, or sore throats or infections of the throat. Your spleen is a lymphoid organ. Your thymus, located in the neck, is a lymphoid organ, and then you have lymph nodes under your arms and in your groin. When somebody has had their lymph nodes removed as part of a treatment for cancer, it's important that we don't take a blood pressure on the side of the body where the lymph nodes have been removed. Now here they're just referring to a woman who's had a mastectomy, because typically when they have a mastectomy and they remove the breast, they also remove the lymph nodes under that arm. Giving a blood pressure in that arm, squeezing that arm, backing the fluid up into the system could cause a swelling of the extremity later. The nervous system is made up of the brain and the spinal cord, as well as the peripheral nerves, which include sensory nerves, motor nerves, but it also includes a very important system known as the autonomic nervous system, which is made up of the parasympathetic nervous system and the sympathetic nervous system. Okay, the